Health officials are calling for a ban on genetic discrimination. That's where insurance companies increase premiums or even deny insurance altogether based on someone's genetics. New research has found that people are starting to refuse genetic tests in case it affects their insurance. A Māori data specialist and ethicist, Dr Karatiana Taiuru, says it impacts Māori more than Pākehā and is an example of how genetic technology in general can disadvantage Indigenous people. He joins me now. Tēnā koe, thanks for your time.
Tēnā koe.
So the current situation, insurance companies can't make you have a genetic test.
Correct.
But they can request the results of any test you've already had. Other countries have banned this. Why haven't we?
I think we've always been a little bit behind the ball when it comes to science and technologies.
Right.
And I think it's quite important for Māori to actually start lobbying their MPs for this because we are being discriminated against.
OK. Well, let's just talk... so this survey that came out in Aotearoa found that patients are denied insurance because of their genetics or wouldn't have their genetics tested in case they were refused. Overall, in a general sense, for all the population, what medical risks does that sort of pose for people?
Sure. So, first of all, I mean, when you were genetically tested, you were tested against a European cohort of genes, which does not match up to Māori genes for a start.
Yeah.
Māori, we're very much a kinship group, so we're very closely related to each other, so you could immediately impact a whole community of Māori. And then,
so immediately impact a whole community of Māori. How do you mean?
So say there's a whole community of, say, first and second cousins, and they have a gene that they've inherited from one of their ancestors that would, say, heart disease or gout or, you know, all the common cancer, all those common diseases.
Right, OK. So would people shy away from getting life-saving medical treatment or life-saving treatment because of this?
I believe so, yes. Part of my research interviewed about 200 individuals about various parts about gene research, and overall they were scared of gene research. There's a mistrust of the health system, there's a mistrust of government, and we've seen generations of Māori who refuse to go to the doctor because they don't trust the doctor or they feel belittled. Is
this genetic testing seen as an extension of that mistrust?
That's correct, yes.
All right, so this research which has come out that we're all talking about at the moment didn't focus on Indigenous populations of Māori or Pacifica. You say that missed an opportunity. Why?
Right, so they basically, we're talking about discrimination with typically European New Zealanders. So basically, Pākehā men and Pākehā women are 50% more likely to have health insurance than Māori, Pacifica and disabled people.
Right, so are you saying that genetic discrimination can affect Māori more than Pākehā? And you're basing that on the research that you've done?
On the research I've done, on the research that's been done in like America, Canada and with other Indigenous peoples of the world.
OK. Is this just an insurance issue, or does the fact that the research is based on genetic sort of cohorts of, say, Pākehā rather than other Indigenous cultures, does it affect other areas of medicine?
It affects medicine across the whole range. And again, because we don't have enough Māori providing genetic information, we only know about basically in New Zealand, it's basically Pākehā genes and diseases that we know about.
So that's the issue, though. So if you have mistrust of sort of the medical fraternity, you don't have enough genetic information, but, you know, how can you actually base policies on that genetic information if you don't have enough? You know, if you're trying to suit Māori policy or Pacifica policy based on genetic information that isn't there.
Correct. That's correct, yes. And so one solution to that would be to implement culturally safe and culturally appropriate gene testing and protocols.
What does that look like? What's the difference?
OK, so from a Te Ao Māori perspective, one Te Ao Māori perspective is our genes are taonga. They're very sacred because they essentially are our whakapapa. So ensuring that there's te tiriti obligations and rights, looking at customary practices, whether it's like a karakia when you're providing a body sample, the storage, there's data sovereignty issues, essentially having the medical staff, the health professionals immersed in being culturally safe would certainly be a big help.
Right, so that would encourage the uptake of genetic testing among Māori.
Correct.
Yeah, you propose Māori-owned and operated DNA banks. Is anybody actually doing that in New Zealand?
So there's one Māori DNA bank in partnership with Otago University and Ngāti Porou Hauora. And from what I've seen, it looks very successful. And if I was Ngāti Porou, I would feel comfortable providing my genes to them.
Right, so but would are you suggesting that each iwi would have to have their own DNA database?
No, I'm suggesting that perhaps different hospitals and different health providers could have their separate Māori DNA biobank for them.
Is it really feasible to develop insurance policies and medicines specifically for each genetic peoples?
I think that genetic testing is flawed. I mean, it's been banned in other countries in terms of health insurance.
Only health insurance.
Only health insurance. Yes.
Yeah.
Yes.
But do you think it's so it should be banned in terms of being used to decide whether you get insurance or not?
That is correct. Yes.
But what about whether it's going to decide whether you can have a certain kind of medicine or not, whether it's going to work for you as a Pākehā or a Māori?
Yes, then I fully support that. Yes, and we know that precision medicine is the way of the future, and it does work. So yes.
But is it feasible? I mean, it means that you're going to have, instead of just one general database, so many different databases for each kind of ethnicity. Is that correct?
No, you could have the one database, or you one biobank in the same building with other biobanks associated with it. So essentially, a biobank's like a big freezer. So you can have multiple freezers in the room.
Multiple freezers and multiple people in those freezers.
Yes.
All right. Thank you very much for your time.
Cool. Thank you.